In this presentation, I'm going to go over how policies are made and what roles they have in today's society. I will also go over some problems with policy and law and why it is important to have them. Some policies are state-level policies, especially in regard to healthcare. Some of the healthcare matters that are managed by the state regulation are provider licensing, accreditation, some aspects of health insurance, and most public health concerns. Each state is so uniquely run that it is not possible to briefly discuss each aspect of regulation from individual states. Once a bill is introduced, the Speaker refers the bill to one or more committees in the House, and the Majority Leader does the same in the Senate. If the multiple committees have differences, they will need to work together in order for the bill to be passed into law by the President. A bill can become law if it is presented and not signed, or rejected after 10 days during congressional session. Otherwise, the bill dies. States have health-related agencies that deal with health financing, aging, behavioral health, environmental health, children and family services, veterans, facility licensing and standards, provider credentialing, and more. Federal level health policy includes the three significant health agencies: the Department of Health and Human Services, or HHS, Department of Defense, and the Department of Veterans Affairs. The HHS includes hundreds of programs that cover activities as varied as medical and social science research, preschool education services, substance abuse and prevention services, and health insurance programs. The Department of Veterans Affairs provides health care services to eligible veterans. The health plans offers a wide array of preventative, ambulatory, and hospital services, as well as medication and medical and surgical supplies. One of the problems we have with some of our policy and law is the Patient Protection and Affordable Care Act. It's one of the most discussed laws right now. Many find that it needs reform. Epstein noted that the absence of price transparency in patient-provider contracts is highly problematic. Patients suffer from both an imbalance of information and an imbalance of power. Kahn discusses many of the problems with health policy and noted, he questions, is the free market the best way to get the highest quality health insurance for the lowest price? In short, no. Not only is our current system not a free market system, it is a for-profit system that is driven by health insurance companies. The influence of interest groups is important to make note of. While they do not have the power to pass laws, they can influence policy throughout the policy-making process. Interest groups may use a variety of strategies to get their message out, which could include providing candidates with money. In conclusion, state and federal policies set the groundwork for how healthcare is given. There are some issues with current healthcare laws, and as we progress with technology, more may come about. Interest groups may not make policy, but they can be a big influence for policy by researching and providing the data, and sometimes with money.